everyone, welcome to another mini lesson. This time we will be focusing on the female reproductive system. So let's start with the external genitalia and we'll look at the vagina and some of the structures. So the perineum is the area between the thighs and it extends from the coccyx to the pubis. And in the female, the external genitalia in this area is collectively called the vulva. The vulva includes the mons pubis, the labia majora, the labia minora, and the clitoris. So all of those structures collectively together are called the vulva. Let's take a look at each of these structures individually. First is the mons pubis. The pubis refers to the bony arch at the front of the pelvis. It's also called the pubic bone. The mons is Latin for mountain. So the mons pubis is the fleshy pad that overlies the pubic bone in the anterior portion of the vulva. The labia majora. Labia is the Greek word for lip. The singular is labium. Majora is Greek for greater or larger. So the labia majora are a pair of thick folds of skin or connective tissue and adipose tissue. And in post-pubescent females or females who have gone through puberty, these outer folds of tissue are covered in pubic hair. The labia minora, again, labia is Greek for lip, minora means smaller, and these are the inner folds of hairless skin that are internal or inside the labia majora. The clitoris is a small erectile organ of the vulva, and it's formed where the labia majora merge. It is analogous to the penis in females because it contains a high concentration of nerve endings and can elicit a sexual response when stimulated. If we look at the structures of the vulva, they're organized from outside to inside. They're organized as labia majora, labia minora, and then the vaginal orifice. Orifice just means opening. During sexual arousal, there's two structures called the vestibular bulbs that become congested with blood and they become more sensitive. These vestibular bulbs are deep to the labia majora on each side of the vaginal orifice. Behind each of these vestibular bulbs, inside the vaginal orifice, there's a structure called the greater vestibular gland, sometimes called the Bartholin glands. These glands secrete a substance called mucin, which helps to lubricate the vagina. This helps to facilitate intercourse by decreasing friction. So again, these Bartholin glands are located posterior to the vestibular bulbs on each side of the vaginal orifice. So we've mentioned the vaginal orifice a few times. Let's talk about the vagina itself. The vagina is also called the birth canal. It's basically a fibromuscular tube about 4 to 5 inches long and connects the vulva with the uterus. The vaginal orifice or opening is located between the rectum and the urethra. And remember, the urethra is the opening to the bladder. You had that in the urinary tract. The urethra is embedded in the anterior wall of the vagina. And at the posterior end of the vagina is the cervix, which is the opening to the uterus. There are blind spaces behind the cervix called fornices. The lower end of the vagina contains numerous folds or rugae. We talked about rugae before. Remember, those are just folds in a membrane. The hymen is a thin membrane. It's an extension of the rugae. The hymen is just a thin membrane, and it's thought to be one of those folds that extends completely or partially to occlude the vaginal orifice. Okay, let's move on to some disorders of the external genitalia and vagina. Vaginosis, remember, osis means condition of. Vagino just refers to the vagina. We'll look at another root word for vagina, culpo, later in this chapter, but in another video. So vaginosis just refers to any disease of the vagina. Bacterial vaginosis is the most common cause of vaginitis in childbearing women. Remember, itis means inflammation of, so you all should know that by now. The vagina normally has a large number of normal bacteria. We call that normal flora. However, when different types of invading bacteria outnumber that normal flora, that normal bacterial flora, then vaginitis occurs. The main symptom of bacterial vaginosis is an abnormal vaginal discharge, and it may have a fish-like odor. Like I said, this can be very common, and it can be caused by hygiene products like vaginal deodorants or medicated soaps or bubble baths or douching. It can be caused by multiple sexual partners or frequent sexual intercourse, although it's not considered a sexually transmitted disease, and sometimes the cause is not known. Toxic shock syndrome is a rare complication of a bacterial infection. This can happen when toxins from certain bacteria enter the bloodstream, and it can cause a life-threatening illness. It is fairly rare, but it is very serious. It's been associated with superabsorbent tampons that have been left in too long or not changed frequently enough. And the first signs are usually a very high fever that spikes suddenly, abdominal pain, dysuria, vaginal bleeding. Vulvovaginal candidiasis is what we commonly call a yeast infection. It's associated with a cottage cheese-like vaginal discharge. We talked about candida infections in previous videos. It is associated with an overgrowth of the yeast fungus Candida, and it causes burning and itching. It's associated with taking antibiotics or the prolonged use of antibiotics because the antibiotics will wipe out the good bacteria that's normally found in the vagina and allow Candida to overgrow and take over. Vulvodynia is the term we use for severe pain around the vaginal orifice. Dynia means pain. And although the exact cause is unknown, it's been associated with postmenopause and osteoporosis. It's also associated with dyspareunia, which is another term for painful intercourse, and the two are often associated with each other. So here's some terminology to review. These terms come directly from Latin or Greek: labia minora, labia majora, and vestibule. Labium means lip, labia is the plural form. Minora means smaller, and majora means bigger or greater. These are the plural forms of these words. And vestibule is the Latin word for entrance, referring to the entrance of the vagina or the first inch or so of the vaginal canal. There's only a few abbreviations in this section of the text. GYN is short for gynecology, which is the medical specialty for the care of the female reproductive system. And OB is short for obstetrics, which is the medical specialty for the care of women during pregnancy and the postpartum period. Postpartum means after birth. And you often see these two together, as in, my doctor is an OBGYN, or I need to consult OBGYN for this pregnant patient. And RN, you probably already know this is the abbreviation for registered nurse, which I think is from the case study in this chapter. Okay, so that's it. It's a short video this time. I will publish some more on this chapter and see you in the next mini lesson.